Speaker, the Deputy Leader of the Opposition said, to paraphrase, that you only value things you pay for. But I have news for her and for the Liberal Party. Australians value Medicare. They value our health system. They value access to a GP. They value access to hospitals, particularly in an emergency, and they value access to affordable medicines through the PBS. And despite the challenges of our health system, it is without a doubt first class in terms of affordability and access, and definitely in terms of quality. You wouldn't want to be sick anywhere else in the world. Labor is the party of Medicare. First introduced through Prime Minister Gough Whitlam's government as Medibank, then abolished by the subsequent Liberal government, but which, as it would seem all Liberal governments, does not value the public good of universal health care, then reintroduced as Medicare by the Hawke government. It is a fundamental part of the Australian way of life. It has improved the overall health of the country, has increased our life expectancy and has eliminated medical-related bankruptcies. But that hasn't stopped the Liberals and Nationals trying to undermine it. Who can forget when the now opposition leader Peter Dutton was Health Minister, he tried to introduce a GP co-payment, and when Labor blocked it in the Senate, he froze Medicare rates to try and force GPs to stop bulk billing. He cut $50 billion from public hospitals, $200 million from emergency departments, tried to force the introduction of fees to attend a hospital emergency department. He tried to add $5 to every prescription, which would have meant a significant impost on many people who rely on multiple regular medications to manage their health conditions. In comparison, we have cut the price of prescriptions, frozen PBS prices, introduced 60-day prescriptions to further cut the cost to patients, moves he tried to block. And he abolished Health Workforce Australia, which the AMA said would undermine capacity to ensure Australia has the right number of doctors in the right places. And sure enough, that's exactly what happened. No wonder he was voted by doctors as the worst health minister ever. In comparison, we have tripled the bulk billing incentive, which has resulted in a 4% increase in bulk bill consults across South Australia, including in my electorate of Boothby. The government's 24-25 budget provides $2.8 billion to continue to strengthen Medicare, on top of the historic $6.1 billion investment in Medicare in the previous year. In 2023, we delivered the biggest indexation boost for Medicare in 30 years, and this year we delivered the second largest increase, with almost $900 million in additional funding for Medicare. This government has delivered more than double the amount of indexation to Medicare than the previous government did in almost a decade. And, Deputy Speaker, what a surprise! This has resulted in more junior doctors deciding to become GPs, up by 25%. In the last 2 years, 17,846 new medical practitioners registered to practice in Australia. That is more than any time in the last decade under those opposite, because it turns out doctors want to work in the interesting and vital area of general practice if they can see it's financially sustainable. One of the election commitments that I was most pleased about at the last election, having worked in the health sector, was the announcement of 50 Medicare urgent care clinics across Australia, including one in Marion in my electorate. Since then, they have been such a raging success that we've actually opened 77 Medicare urgent care clinics. The Marion Urgent Care Clinic's been open for just over a year now and has had over 12,000 patients through its doors. That's 12,000 people who were too sick, too injured to wait for their normal GP, but not bad enough to go to an emergency department. People who instead got seen at the urgent care clinic instead of presenting to the hospital ED. Now, you would think that this amazing success story, making a direct benefit to the health of Australians, would be something we could agree on in a bipartisan manner. But no, the Shadow Treasurer has made it very clear that if a Dutton government is elected next year, the urgent care clinics are on the chopping block. They are making a deliberate decision to force Australians to have to choose between turning up to overcrowded emergency departments and making wait times even worse, or waiting to get an appointment with their GP, even if they're injured on the weekend. Labor is the party of Medicare. We know how important this is to the Australian way of life, and you can't risk a Dutton-led government with the health system, led by the man voted worst health minister ever.